Hello, welcome to Oral Arts Quick Tips from the Lab. Today I want to talk about how to do crown under partials using a polyvinyl siloxane impression material. In some subsequent episodes we're going to talk about doing crown under partials using a intraoral scanner. So in this episode I want to talk about the three most common ways that we see doctors doing crown under partials and the best way in our opinion to do them. This treatment plan is pretty problematic for a dentist. We find that they have a lot of adjustments and some trouble when they're doing these type cases. So this is in hopes of minimizing those adjustments and getting those crowns down as quickly as possible. The first technique that we see utilized is a doctor doing some type of blue mousse matrices of the intaglio side of the partial. So doctors will inject blue mousse underneath the partial clasp assembly when the partial is fully seated in the mouth, and they're doing that step after the crown has been fully prepped. So they're taking a prep impression and then they're using their blue mousse to try and capture the clasp. That's good in the sense that the patient can walk out with their partial, but it's bad in the sense that the lab then has to replicate those clasps using some type of material. We use Duralay. For those of you that have used Duralay, it's not the most accurate material in the world, but it's what we have found that we can use to replicate these clasps. So the Duralay is not all that accurate. I mean, we're getting the job done. We're fabricating a crown underneath the Duralay clasp, but I personally don't like that technique. The other technique I see used is just the doctor sitting in the partial. Well, that's great for the lab. We have everything right there, but the patient really is not happy because they left with not as many teeth in their mouth. So the technique that I personally like, and the technicians here like as well, is a pre-op impression technique. Let's say the tooth is completely blown out and you've got cusps that are fractured off or whatnot that were underneath that partial, and you need to crown that tooth. If the contours of the tooth are not ideal, you can build them up with some type of composite just real quick, or if the tooth is how you want it, the contours are how you want, just take a pre-op impression. That's it. Take a pre-op and then you prep your tooth down and you take a prep impression. And you can send us both impressions, and what we do is we pour up both. We scan in your pre-op model and we will copy mill and exactly replicate the contours of that existing tooth in our 3Shape or exocad softwares, and we just mill out a crown. So in today's world, you don't need a PFM crown under a partial. It's absolutely not needed. We see no reason to have one. We're doing hundreds of these crowns under partials in zirconia all the time. The one thing I do want to caution you on is if your impression has some pulls on it. So if the pre-op impression is not accurate, then it's going to make it difficult to produce a good fitting crown, because we're going to be reproducing the contours we have on the pre-op model. But that's a pretty easy thing to avoid. You just basically quality control your pre-op before you send it to us. If your staff is pouring your pre-op models, just be sure that there's not any big pulls on that tooth you're trying to crown, and you should be good to go. I hope this helps you on your crown under partials. Be sure and stay tuned if you have an iOS system to watch our subsequent videos that are going to focus on this using iOS. Thank you all.